ONtheGO podcast.
A nose for cartilage. The future of nasal chondrocytes is our hot topic of the day with today's guest, Professor Ivan Martin, Head of Department of Biomedicine, University of Basel, who shares his fascination for discovery in a coffee break with Dr. Jari Dahmen, Amsterdam University Medical Centers, University of Amsterdam. My name is Takao Shima, and this is On The Go, the podcast all around orthoregeneration.
All right, I'm very delighted to welcome Professor Ivan Martin on the ONtheGO podcast. We're happy to continue again after the summer, and as always, we start with our first question. We welcome you and we ask you how you drink your coffee, how often, how much, and what is your favorite place?
Yeah, so exciting to be here with you today. So I'm a rather systematic person. So I only have one coffee after breakfast in the morning and one coffee after lunch in the afternoon. I allow myself every second week or so to have an additional coffee in the morning or afternoon. And that's a simple way to make that day very special. My favorite place to drink coffee professionally is actually after lunch with the people in my research group in the garden of a hospital, having informal chats and getting to know them more as persons. And in a private setting, obviously, with my wife in the garden of our place. But I sometimes also have green tea that I enjoy.
I can tell. So you told us, the listeners, that you also allow yourself to sometimes have an extra coffee on a busy day. Does that happen often, or is it usually quite scheduled?
Yeah, if I make it too often, then it's not a special day any longer. So I try to keep it as for special days. But every second week or so, I do have an extra coffee.
All right. Good to know. And I think we can conclude that the garden is maybe your favorite place for a nice cappuccino or espresso.
Yes, absolutely.
All right. So diving into our podcast today, in which we talk about the topic of having a nose for cartilage, which is kind of the play word for what we will be talking about later on. We first want to get to know you a bit better. Could you tell us a little bit more about yourself? You are affiliated at the University of Basel for already many years, and you're leading a very influential tissue engineering department in orthopedics. Could you tell us a little bit more about how that path went and what your current role and affiliation is?
So I came here to Basel now 26 years ago as a junior group leader of a small group that over time extended in size and in visibility. But now since 4 years, I'm also the director of the Department of Biomedicine, which includes now 69 research groups across all areas of biomedical sciences, immunology, oncology, neurosciences. So my time for my pet research activity on cartilage and bone regeneration has drastically reduced since then. But I enjoy actually some activities around management of a research institution, trying to give back to new professors and junior scientists what I have received in the previous years.
All right. And how do you manage both on the one side, managing a group of professors, a group of research groups, and still having enough time and dedication for your research pet, so to say?
The key element is having a good team. So I have people whom I very much trust and with whom I enjoy working together, who take over more responsibilities, which I find is also important for them so that they can have a chance towards independence. And I think it's a win-win condition. I feel less this research being driven by me, but that's part of the game, and that's it's natural and good that it's like this.
And do you miss it sometimes, dedicating 120% of your time only to your pet research?
Yeah, I miss it when I recognize maybe I would have done an experiment in a different way, or I would have structured a manuscript in a different style. And in the end, again, if a team is good, I see this as an initial maybe disappointment, that then ultimately as an enrichment, because I see the influence of other people into my style, my approach. So I do not regret it at all.
All right. We're also delving a bit more into your research pet, which is cartilage, nasal cartilage, bioengineered autologous cartilage. These are some terms that you have been researching quite a lot over the past decades. For our listeners who are a little bit less familiar with these terms, could you tell us a little bit more about what is engineered autologous nasal cartilage? How does it work? How do we use it? And where are we today with it?
It was more than 20 years ago that we actually discovered, initially quite by chance, that nasal septum-derived cartilage cells have a much higher and especially much more reproducible across patients capacity to regenerate new cartilage. And this finding was the beginning of a series of studies aimed at generating patches of biomechanically more functional cartilage that could be used as a graft in regeneration of initially fresh focal cartilage defects, and then later on also degenerative cartilage injuries. So the concept is relatively simple. So from a small biopsy taken from the nasal septum, the cells are expanded in culture. They are loaded on a collagen membrane that is commercially available through Geistlich, the chondro guide, and then the resulting engineered tissues after 2 weeks of culture of the nasal chondrocytes into this membrane, leading effectively to a patch that feels like cartilage, is implanted through a mini arthrotomy into the articular cartilage defects of patients. We have treated now more than 100 individuals in the knee. Two independent phase 2 studies, degenerative osteoarthritic cartilage lesions in a total of 225 individuals, funded by the Swiss National Foundation and the European funding system. In large multi-center studies involving a total of 13 clinical groups all around Europe, which is in process, and that is hopefully leading us to a possible disease-modifying solution for osteoarthritis.
So if I listen to you, it's been quite a journey on this whole research path, from engineering it to now applying it in daily scientific practice. Did you encounter that there were some people who were skeptical about the usage and the application of nasal cartilage cells?
Yes, very much. I remember, especially from the developmental biology standpoint, I remember Charlie Archer from England was challenging the concept, indicating that nasal chondrocytes derive developmentally from the neural crest, so the cranial compartment, and not from the mesoderm, which is our articular cartilage cells develop. And so he was challenging that there would not be compatibility and capacity of a biological engraftment of this new cell type. And this was an interesting and important challenge that pushed us to demonstrate at biomechanical level that actually nasal chondrocytes can respond to forces typical of joint loading very similar to articular chondrocytes. And it pushed us into the definition of epigenetic differences between nasal chondrocytes and articular chondrocytes, but also to the recognition of the plasticity of environmental plasticity of nasal chondrocytes to be able to acquire the epigenetic features of articular chondrocytes upon implantation in a joint environment. This has been and is currently the subject of more fundamental research that is financed through a ERC synergy grant in my research group, and that aims at dissecting where is the enhanced regenerative capacity of nasal chondrocytes encoded in the cells, and at the same time, what makes the nasal chondrocytes plastic enough to be compatible with the articular environment, so to ultimately address this biological challenge that was making people skeptic about the concept.
Mm-hmm. And just to understand the concept a bit better, if we compare an articular cartilage cell or an articular chondrocyte to a nasal chondrocyte, what are maybe the 5 most important differences between them?
So functionally, as I said, what we see is a enhanced cartilage regeneration capacity, enhanced repeatability of chondrogenesis. But at the level of, let's say, epigenetic signature, what nasal chondrocytes have is the lack of expression of certain HOX genes and associated poised accessibility of chromatin locations. So, which means ultimately translated from developmental biology, higher capacity to respond to environmental signal and to acquire different possible phenotypes. This is a feature that is typically associated with neural crest-derived cells, where most of our primordial organs, the brain, the eyes, reside, and that endow these cells with a known enhanced functionality, plasticity, and regenerative capacity. So it's a mystery in the way that nasal chondrocytes that seem to be trapped out of this neural crest compartment in this little septum of the nose, but still retain certain elements and traits of other cell types of a cranial compartment. We are actually now trying to dissect the transdifferentiation capacity of nasal chondrocytes even into neural cells based on their origin primordially. And we're discovering certain fascinating new things about, again, plasticity of nasal chondrocytes.
Wow, that's amazing. And when I was preparing the podcast for today, I discovered a relatively recent manuscript that you and your group published in the BMJ Open, describing a protocol for the usage of nasal cartilage for patellofemoral arthritis or patellofemoral chondral defects. Could you tell us a bit more about this protocol, where it's going to take us, and what you think the outcomes will be? the study?
So the protocol is fundamentally the definition of a translated investigator's brochure for the one of the two clinical studies, which has just started for the treatment of patellofemoral osteoarthritic defects in patients. So it describes the inclusion-exclusion criteria, and ultimately it aims not only at offering an open access and transparency to what we are working on, but also it tries to define all the possible elements that can be measured in these patients pre and post operation, so that at some point we can derive some predictive biomarkers indicating for which specific category and subcategory of osteoarthritic patients this technology and this product based on nasal chondrocytes can be predictably effective clinically.
Yeah, and you will be comparing the nasal cartilage to another treatment option, if I'm correct. What do you think the treatment effects or the treatment differences will be between the other treatment option?
So in the two clinical studies, we are using two different comparators or control arms. In one study, we will compare, and this has been a subject of intense discussions with the reviewers of the grant applications, with the clinical and scientific community, because as you know, there is no standard of care treatment for osteoarthritis. So in one study, we ended up convincing the reviewers and the funding agencies to compare our treatment with the injection of PRP, which is clearly not considered yet as a disease-modifying procedure, but is often offered to patients with this type of indication. And in the second study, we will differentiate between two stages of advancement of osteoarthritis. In the milder stages, we will use as a comparator the collagen membrane without cells. So the backbone, fundamentally, of our nasal engineered cartilage. And because this is sometimes used with certain, I think it's ethically acceptable to use it as a control. And for the most advanced stages of osteoarthritis, we will actually compare our procedure with a prosthetic implant, so with a knee replacement.
Yeah.
So it's a complex study design. It will be an extremely challenging data analysis having these different groups. But now we are in the phase of recruiting patients, and that's what is keeping us busy.
Amazing. Well, we're looking forward to the results and the publication in maybe 1, 2, or 3 years, if I'm guessing that in the future.
It will take at least a couple of years to complete recruitment, and the follow-up will also be another 2 years. So it will take some time, but happy to remain open to the scientific and clinical community on how things are proceeding.
Yeah. And then now we're already talking about the future and the future of these results. With your expertise, could we pick your brain a little bit on where you think the field of this exciting field of nasal cartilage and cartilage engineering will take us in about 20 years? Just as a guess, where do you think we'll stand in about 20 years with this exciting field?
It's probably an obvious answer, but there will be a strong influence of AI in the field. And what I imagine is, and I hope, is that based on the assessment of multidimensional parameters of patients, based on automated imaging analysis or serum biomarkers or self-recorded let's say, status of a patient's algorithms will directly define what is the possible surgical or conservative treatment that is best designed for that patient in a highly precision medicine approach. And maybe I hope that across all these different treatment options, there will also be for a subcategory of patients the use of nasal engineered cartilage as the best possible solution. And there, what we are currently offering is probably not the end stage of what could be done. So we are collaborating with synthetic biologists to have a genetic transformation of nasal chondrocytes as logic-gated designer cells that can be enhanced in functionality by having an encoded genetic system to sense certain environmental parameters in the joint, and based on a logic gating and or conditions, overexpress or silence certain factors. And this will hopefully be the next step to have a dynamically better controlled entity in the joint that is smart enough to react to the fluctuations of inflammation or of metabolic changes which occur in the joint, and counteract to instruct regeneration or homeostasis whenever necessary.
Yeah, well, that's very interesting, I think, and maybe also brings us indeed into the future of this field. What could you tell us a bit more about the logic gate principle? Just maybe also for myself, but also for the listeners, what this exactly is.
Yeah, so for example, when there is a higher level of inflammation in the joint sensed by certain cytokines, associated with certain metabolic parameters, for example, increased lactate production, and not certain other conditions which could be related to other factors, maybe reactive oxygen species that are found. So the and or logic could be encoded genetically in the cells, so that the cell would decide, okay, now it's time to overexpress IL-10 or to suppress IL-1 signaling. And it's a bit of science fiction, but that's what synthetic biologists teach us that is nowadays possible.
It's a very dynamic approach towards a specific problem, I think.
Yes, which is temporally adapting and patient-specific adapting over time.
Wow, very cool. Very, very cool. We're slowly already going towards the end of the podcast, but both at the beginning and the end, we try to get to know our guest of the podcast a bit better. You mentioned in the beginning of the podcast that you combine management with still leading a group of scientists, being head of the department and still being group leader in science. Could you give our listeners some advice for young surgeons, young doctors, young clinicians, and scientists? Some advice on how to start in the field and how to become successful in the field. What is your vision on this?
Yeah. So I work daily with clinicians. Our department is a translational department. And I see a fundamental difference between clinicians who play with research and those who are deep, seriously, curiously interested in research. And I can see the outcome of these two categories. And I would strongly encourage those scientists in general, but clinicians specifically, because always this comes on top of everything else, not only to pursue a scientific clinical career because of opportunity, because of chances that would open up in the career, but because of sincere motivation to understand, to discover, to learn. Because without this intrinsic spirit, everything will be much more difficult and much less successful. So keep up with curiosity and with the intrinsic spirit of being a scientist, which should push us not to remain superficial, but to go deep, to dig into the literature, to ask the right questions. And that's what I would suggest.
Would advise to our OrthoRegeneration network members that are on the younger side of the listeners. Then maybe also for yourself, if you could name one or two persons, could be dead or alive, that you would be very intrigued to meet or to have a coffee with for inspiration of your daily work and life, who would you choose?
That's a difficult question. Maybe I would like to have a coffee with a person who originally inspired me being a scientist. So exactly reaching this spirit of fascination for discovery that I was arguing for. And that is Rodolfo Quarto. He's a medical doctor, but who is has been fundamentally dedicated his life to research, and as a freshly degreed master in engineering person, I approached him, and he was able to show me the mysteries, the fascination, and the excitement of research, and guiding me into the initiation of my scientific career. We have a bit lost each other over time. So I would enjoy having a coffee with him and looking retrospectively and maybe even prospectively into our lives.
All right. Well, I think our listeners and myself and Taka behind the screens here have really enjoyed the podcast. We've gotten into the world of nasal cartilage, the future of nasal cartilage, and bioengineering behind cartilage, and also your advice on how to manage a team and advice for younger scientists and clinicians. So really, thank you a lot for being on the podcast, and hopefully see you soon on a conference or another event.
I enjoyed as well the conversation. Looking forward to meeting you and to connect further with the ON network.
Thanks so much. Amazing.
This was ONtheGO, the podcast on orthoregeneration. For more content, stay tuned at my.on-foundation.org. Thanks for listening and have a great day.
Free audio post-production by ONtheGO.com.